Well, my first guests are joining me here in the studio, two gentlemen. The first one is Mr. Richard Lagani. He's an Executive Vice President of MMRGlobal. Richard, good to see you again.
Hi, Don. It's nice to see you as well.
And we have a visitor from Australia, Mr. Jacques Blandin. You are the CEO of Visi Inc., PLC. Welcome to the program, Jacques.
Thank you, Don.
Now, let's start, Richard, and say, why Australia?
Well, Don, as both myself and our CEO, Bob Lorish, have been talking to you over the course of the past year or so, MMRGlobal means global. And Australia is an untapped market. The federal government in Australia has instituted mandates for electronic medical health records. We wanted to find a good, strong partner, and that's what we found with Visi Inc.
Well, Jacques, tell us a little bit about Visi Inc. This is really interesting.
Visi Inc. has developed some unique technologies and in the collaboration and communication space. And also, we're currently in the process of acquiring a couple of companies in America in the video conferencing space to integrate with the technology we've developed. And MMR is a fairly important part of our future in Australia.
Now, I know we're sitting here having this interview about a week before the International HIMSS Conference, I think in Las Vegas. What's new, Richard?
Well, I mean, the timing for Jacques to come and visit us in America is perfect because of HIMSS coming up. And HIMSS, as people may or may not know, is the Health Information Management Systems Society. So that brings in one place all of the key players in healthcare IT. So we're getting together with all of our partners with a large booth at HIMSS and displaying and showing the world again what it is we do with our products. We're going to bring in some of the Visi products. We're going to bring in some new products from other partners we have, and it's going to be an exciting event.
Now, I just have a question about the HIMSS conference, because for our audience watching, what kind of people attend this conference that you'll be interacting with? Who are you looking to meet?
Primarily other CEOs, COOs, chief information officers from different corporations. We look for two things really. One, there's a huge influx of medical professionals that come in, so doctors, healthcare providers, administrators of hospitals. That's one key target for us. Then we look for other strategic partners. Who's doing the best in the space that we might be able to work with?
You know, Jacques, as Richard said a moment ago, we've been talking about medical records and the e-health landscape as it applies to MMRGlobal for the last several months. How does that landscape, tell us what the landscape in Australia on those two fronts?
Australia is fairly new to the e-health market, both from a medical record perspective, personal health records, as well as telemedicine. What we believe we have in Australia through MMR is the only solution which satisfies the government initiative towards e-PHRs, so e-personal health records. So what we've done is we've adopted the MMR system via a marketing, distribution and development agreement with MMR. And we represent MMR in Australia. Further to that, we're just about to sign off on a patent license agreement with MMR. Unknown to the world in general, MMR has possibly 8 patents in Australia for e-personal health records, which they were granted between 2006 and 2009. What it'll mean is that from an Australian landscape, we'll be able to enforce those patents and also have a product which we can deliver to the population at large through MMR and increase MMR's revenues as well as our revenues.
You know, it just so happened last night I was watching one of my favorite films, Casablanca, on TV, and the last line is, "This is the beginning of a beautiful friendship." Seems like that's what's going on here. What's on the horizon for your two companies, Richard?
Well, I think between the technology we have, which is leading cutting-edge technology, and the technology that Visi has, we're bringing together a really neat synergy. And the video conferencing and telemedicine are all areas that we want to expand into.
Well, gentlemen, this has been very interesting. Now, I know the HIMSS conference is next week. I think we've actually scheduled that we're going to talk to you via satellite from the HIMSS conference. We're looking forward to that. Jacques Blandin with Visi Inc., Richard Lagani, thanks so much for joining us.
Thank you, Don.
Thank you very much, Don.